This is Schizophrenia Part 3. This is Schizophrenia Diagnosis. So basically the first thing that is usually done is an observational data team sort of collects information via their family member or the community health support team. This can be the general practitioner or anybody who's involved with the person. It could even be school counselors or even teachers for that matter. So if it is a GP, the GP usually refers the person to a psychiatrist. And as I said in the very first video, usually the first thing noticed is the delusion of grandeur. Now it can also be the opposite of grandeur. It can be somebody who just feels that they're nothing, and hallucinations may be present. So again, diagnosis continued. The psychiatrist will rule out bipolar disorder and schizoaffective disorder. A bipolar, this is the first type of bipolar. I'm not getting into detail with bipolar disorder, but this is the one that's manic depression, periods of mania and periods of depression. And this may manifest itself like a psychosis because there are hallucinations and delusions. Schizoaffective disorder is very similar to residual schizophrenia and can also be seen as residual schizophrenia, but it differs as it's usually really stable and it only is triggered by stress. So one thing that may be used as a personality test. Basically, it's just a multiple choice thing where you fill information about yourself. Now, this is actually a very poor way and is not used very often anymore. It can be falsely taken. A person can manipulate the results easily, and they need the right time frame for the sufferer. The sufferer cannot be in a state of psychosis. He has to be in the right state of mind. This is basically looking for delusions and hallucinations and the lack of self-care. And it's a lot easier to sort of observe, this latter part. Like, it's a lot easier to observe delusions, hallucinations, and lack of hygiene than it is to actually see from a personality test. So you may notice disorganized behavior when you're observing the person. Like, they may have an odd way of putting items in place, like an odd way of just very disorganized. They may dress inappropriately for climate weather. Like, you've probably heard that a lot of people with schizophrenia, they dress very warmly in hot weather, and sometimes in cold weather they wear almost nothing at all. They may have declining function, so they may lack sleep or lack hygiene. Anhedonia, also pleasure in daily activities, like some things that they really love doing, they'll just have no interest. There'll be coordination loss. It'll appear clumsy, but really it's just, the fact is, they actually have, and it may even appear deliberately clumsy, but the fact is their coordination is just lost. And problems with speech. There is somebody whom I talked to who had schizophrenia said their tongue felt like it weighed 1,000 pounds. So it will first be observed the patient is incoherent, and because of this, they have to outrule the fact that it's a physical condition. So usually a simple diagnostic test, such as a blood test or urine sample, will rule out if they're toxic to a drug or if they have a urinary tract infection, because these can mimic a psychosis. So, the Rorschach, I hope I didn't murder the pronunciation of that, is often used. So they might show like a picture like this, like you can see an old man here, or you can see a young woman there. Now, they may also do an interview, and this will just test for odd behaviors and triggers, but Rorschach exam is almost always brought in with it. Now, this can also be inaccurate because somebody who has natural creativity or is actually a genius will notice this in seconds as well. So, screening tests. So, meningitis, UTIs, and drug usage, tumors, and lupus can all mimic a psychosis. So, naturally, you need screening tests done. I mentioned blood tests for UTI and lupus and drug abuse, but diagnostic imaging is actually really useful right now and is getting better over time. The two diagnostic imaging tests that radiologists will do are the MRI and a CT scan. Now, computed, I just murdered that. So CT scans, they can detect tumors and all that, but MRIs are generally even better, especially when you have a functional MRI. Now, I noticed I mentioned in the very first video that the ventricle in the diencephalon is enlarged, like that's the butterfly-shaped one, the third ventricle in the brain. So a functional MRI can actually see if there's excessive dopamine production at the substantia nigra, which is the site that produces dopamine. And high dopamine levels are actually the reason for schizophrenia. That's why here in Canada they're planning to legalize marijuana, and unfortunately more people will have schizotypal disorders due to the fact that excessive dopamine production will eventually cause that. So another thing that can be done is assess the family history. Generally it's the case that it runs in families as well. It sometimes skips a generation, but sometimes doesn't. Assess their childhood. How were they when they were a child? Check for things like fleet of thought, like especially in the schooling years, and abnormal people skills, especially when they're growing up. Like if they had, almost everybody with schizophrenia has a type of autism, and this should be done over a period of time and at multiple stages of their life. So the next video will be treatments. Comment, rate, and subscribe. Thanks for watching.